I'm not talking about the decision by the United States to withdraw from WHO. I will not comment on that today. I'm talking about cuts to direct US funding for countries through USAID, the US CDC, and other agencies. The impact of these cuts will be even greater, and we're already seeing them. There are now severe disruptions to the supply of malaria diagnostics, medicines, and insecticide-treated bed nets due to stock-outs, delayed delivery, or lack of funding. Over the last 2 decades, the US has been the largest bilateral donor to the fight against malaria, helping to prevent an estimated 2.2 billion cases and 12.7 million doses. If disruptions continue, we could see an additional 15 million cases of malaria and 107,000 deaths this year alone, reversing 15 years of progress. It's a similar story with HIV. The suspension of most funding to PEPFAR, the President's emergency plan for AIDS relief, caused an immediate stop to services for HIV treatment, testing, and prevention in more than 50 countries. 8 countries now have substantial disruptions to antiretroviral therapy and will run out of medicines in the coming months. Disruptions to HIV programs could undo 20 years of progress, leading to more than 10 million additional cases of HIV and 3 million HIV-related deaths, more than triple the number of deaths last year. On tuberculosis, 27 countries in Africa and Asia are facing crippling breakdowns in their response, with shortages of human resources, disruptions to diagnosis and treatment, data and surveillance systems collapsing, and vital community engagement work deteriorating. 9 countries have reported failing procurement and supply chains for TB drugs, jeopardizing the lives of people with TB. Over the past 2 decades, US support for TB services has helped to save almost 80 million lives. Those gains, too, are at risk. On immunization, WHO's global measles and rubella network of more than 700 laboratories, which was funded solely by the US, faces imminent shutdown. This comes at the worst possible time when measles is making a comeback. Last year, there were 57 large or disruptive measles outbreaks, and that number has been increasing for the past 3 years. Since 1974, measles vaccines have saved nearly 94 million lives, but those gains are also at risk.